Welcome, Chris. Thank you for coming into Sun City TV studio. We've got some residents in Sun City who've got some challenges right now with medical care availability. And these residents, let's say particularly our newcomers and those who've maybe had a physician who's retired or moved out of the area, are a little surprised at the number of primary care providers that are available and accepting new patients and the length of time it takes to secure that first appointment. What's causing this?
Well, that's a very good question, Georgia. I think, you have to consider, depending if you're new to the area or, to your point, if you just lost a provider due to retirement or maybe they moved out of the area. One of the big reasons for this really is the population growth into the Low Country, specifically Beaufort County. This location has always been popular for vacations and retirements, but really over the last 5 years, we have seen a tremendous growth in the population here, both north of the Broad and south of the Broad. On top of that, you're coming from communities, perhaps larger cities where you've been established with primary care for 20, 30 years, been an established patient. You haven't had to kind of fight for a new patient slot. And so, that's a big challenge for getting folks in. Recruitment also, is getting new providers going through the institutions, whether they're physicians or our advanced practice providers, PAs, nurse practitioners. The institutions really can't keep up with the need quickly enough. So the throughput takes some time. And so you're getting a new provider and in 8 months, their patient panel is filling up. And so that's a big challenge.
Now, do you have any recommendations for those of us facing this challenge?
Yes. What I recommend, if you're new to the area, I would go ahead and call a primary care provider. We have about 56 primary care providers across our medical group, so the largest portion of any specialty within our group. I'd go ahead and get on the schedule. I wouldn't wait. That way you can have your visit to established care. And if there's something that pops up in the interim, we have 3 express care locations, urgent cares. And so we're all the same electronic medical records. So if you see one of those providers, when you finally get to your primary care provider, they have all of your records and they can see everything.
Now, specifically, does Beaufort Memorial have resources for patients to go on and find primary care providers that are accepting new patients?
Mm-hmm. We do. So there's a couple of different, modalities that you get information about us. If you're new to the area, you get a lot of mailers, and we promote all of our specialties really to things that you might need, including primary care. You can go to our website, BeaufortMemorial.org, and you can look for our providers, any specialty, specifically primary care. We will have those that are listed and currently taking patients. Now that changes because as patients move out of the area, or we just add more providers, those panels kind of open up and close. And so we're constantly looking at access. On top of that, members of my team may kill me for saying this, but 2 weeks ago, we launched online scheduling. So in our primary care practices, all of them, for established patients right now, you can go ahead and schedule your appointment online versus having to call the practice and get on the list. But those are great opportunities. Very soon, we'll be opening up to new patient visits, so you'll be able to see those as well.
Now, is there a best way to get an appointment initially?
I would do a little research, see what providers are out there who are currently taking patients, find out what that practice is, go ahead and call. We may be able to get you in very quickly as the provider ramps up, or we'll get you on the schedule, or maybe you can be on the wait list. And what we do is we kind of cull back through that wait list as openings occur and try to get patients on that time. In addition to that, we have systems that will help as slots come open. You might be 3 months out, but there might be a slot that someone canceled opens up. So it'll reach out to you and say, hey, Georgia, would you like to move up your visit 2 weeks? And you say, absolutely, and you can accept it and come earlier.
Now, we get through that first hurdle. We've had our first initial appointment. What is the importance of becoming an established patient, and is there an advantage or benefits to being an established patient?
Well, obviously, as a physician practice or a panel of patients matures, you're going to have more established patients and new patients vice a brand new provider. So once you're established and you keep up with that, that kind of keeps you in the groove. I won't say a priority, but it's just the ratio of slots open, obviously. But for your care, in most cases, you're coming, depending on what your age group is. If you're 55 and older and comorbidities, you might come 4 times, let's say, in an 18-month period. 18 months is important because that's when I look back and see what's the active patient panel of any provider.
And we're going to talk about starting with a very exciting piece of news. Everybody here in Sun City is starting to hear or waiting to hear about the Beaufort Memorial expansion. Welcome, because you're including a hospital right here in Bluffton for us. So, we've been talking about medical care availability. How is Beaufort Memorial working to provide more medical professionals in the area to not only care for the medical practices we have, but now to staff the new facilities? Challenge.
Yes, very good question. And I've been working on it for some time, really leading up to development of staff to include physicians and advanced practice providers as well. So obviously we've got the hospital coming, we've got some other things in the works as well, but we have been working with not only our internal recruitment forces for providers, for nursing staff, MAs, various techs, those sort of things. We've also been working with Medical University of South Carolina. As you know, they're building a outpatient building kind of across the street from the hospital, and so they will have providers that are on our medical staff as well. So they're going to bring some specialists to the area and to include what we're already recruiting. We already are working, at least currently, with their emergency department residents. So they are sending their residents down to our emergency room in Beaufort campus and rounding with them. So we're preparing ourselves to staff both in Beaufort, in Bluffton, as well as another project that we have going on with our freestanding ED on Hilton Head as well. So a lot of work to be done there.
It sounds like you've got some things really in the works already. I have to believe that with this growth in our population and just the challenges you're facing, what are some of the barriers to recruitment in this area, and how are you working to overcome those?
Well, you know, there's a lot of things. We talked in our previous segment about the institutions not keeping up with the demand. And so the supply is short from the provider standpoint to the nursing shortage that people have talked about for really decades across the country, not just in South Carolina. So what we have really done, you know, in recruitment, but looking at those challenges when you talk about housing costs, not only for providers, but for support staff. Many of them have to live outside the community and drive in. And so we're doing a lot of efforts around workforce housing development throughout the county to help have more affordable housing for those staff, to help recruit and get them in addition to the internal efforts of developing staff that are already here that maybe aren't in healthcare yet, but want to be in healthcare. And so they're already in the market, but they dreamed about being a nurse one day. And so we've got a lot of partnerships to help overcome those hurdles and develop the staff internally.
Are you finding that there are particular medical specialties that are very difficult to recruit, and why are those so difficult?
Well, I'll go back to primary care. Primary care is very important. I don't think we ever close recruitment efforts for primary care. It's always open and probably recruit anywhere from 3 to 4 primary care providers a year. Rheumatology and endocrinology are 2 subspecialties that we hear a lot about. There's just no one in the market to do it. And so we've made a lot of efforts and outreach to try to get those folks. MUSC, again, is a great partner, being a big academic facility and campus and system and tertiary care. They've got some pull to help us get those specialists in the market. And I think much like those out there that have long waiting lists, like dermatology, you're going to see a lot of people that need to get into rheumatology and endocrinology, but we are working towards those efforts with MUSC to help us in the community.
Oh, and it just sounds like those top 10 lists of all those things that we geriatric patients need.
Exactly.
So thank you for getting on that.
Yes.
Is there an area, you know, we've mentioned perhaps, but, you know, the top target area that's really our most deficient at this point?
I think, you know, we've got some work to do in increasing urology access, gastroenterology as well. Obviously, we talked about endo and rheumatology. Primary care still remains. I'll go back to that's kind of your base. It's your foundation. And they are the incrementalists that are taking care of you over time versus say I just need to pop in, occasionally to see an orthopedic surgeon or maybe a cardiologist occasionally. They really help kind of gauge the health of the community and drive what we need in the other specialties.
Well, it sounds like Beaufort Memorial is working very hard to make us, feel good about the care that's coming toward us even more, at a distance that we've never expected to see a second hospital so close. So thank you for that. Thank you for coming in with this information. And I hope you keep us updated because we love to spread the word when it sounds so positive.
Absolutely.
Thank you.
Thank you.